Talking about lost snakes, well, now we're going to losing weight. And if you'd like to trim the fat for the new year, but liposuction seems just a little bit scary, you might want to consider Tickle Lipo. The procedure is not only considered more effective, the tool used is also less invasive. Now, Dr. Tess Mauricio is with us this morning to explain exactly how it works.
Absolutely. Well, Tickle Lipo, the full name is nutational infrasonic liposuction.
Tickle's a lot easier.
Right. Well, the reason I was explaining to you, the reason why it's tickle is because of this special movement that the cannula does to gently shake off the fat cells without disturbing the connective tissue underneath. So it's a lot more gentle, less trauma, so it less recovery for patients, and they're really able to now get really nice skin tightening afterwards because we are preserving the tissue underneath.
You said it's just like a vibration, more or less, that breaks up the fat. Is that right?
Exactly. It's a vibration, and in certain areas we actually get patients being tickled and laughing through the procedure, and they're able to do it awake because it's not there's not as much discomfort as the old traditional liposuction.
And this is actually a smaller tool that you use as well, right?
Right. We're talking about garden hose. That's the old size, and now we're talking about the size of a tip of a pen. And
we're looking at it right here.
Right here.
Yeah.
This is the cannula that we use. This is the tool that we use to really extract the fat, and you can barely see it. It's doing that nutational vibration movement, and you can see that it's very tiny, so we only have to make a tiny little stab opening. We don't even have to put stitches. Those close off, and then they heal like tiny little freckles.
So this is something you walk in, walk out the same day,
yes,
and you're good to go.
Absolutely, and it can be done all under local anesthesia. No more general anesthesia needed, and we can address areas, the abdomen, the arms, the inner thighs, the outer thighs, the love handles, the back. It's really amazing, and patients are very happy. They're surprised at how easy it is.
And you're actually doing a special right now for this type of
Yes. Well,
lipo?
we were running this special during the holidays. It was very popular, but it's basically you pay for one area. Say we do an abdomen.
You keep looking at me. I'm like, okay, she's going to pick
over
out
there,
an area.
those guys over there. Abdomen, and then we throw in the love handles for free.
Right. Okay.
So it's really an amazing deal, and it allows patients to really take care of what's bothering them for the new year.
Get a fresh start. And
exactly.
Speaking of new, you have a new location as well.
That's right. We're opening in La Jolla starting this month, and we're very, very excited. We're going to be able to offer everything that we do in our Scripps Ranch location over there, and check it out. And it's going to be fun. It's going to be a great year.
Now back to the Tickle Lipo. One of the things is the recovery time. You said it's shorter, but you don't necessarily see the results right away. Is that correct?
Well, actually, 24 hours after lipo, when they come in, most patients open and say, "Wow." Because you can see it, but the final result does take a little bit of time. But patients can get a glimpse of how they're going to look.
Yeah, look at these before and after pictures. That's dramatic.
Right, and that's the hips and the outer thighs. And these are patients who probably have been working out for a while. But like I told you, we can take out 8 to 10 pounds of fat in one procedure.
Wow.
But you can see here that patients do not have any loose skin. So that's what's really amazing about Tickle Lipo, is that as it preserves the connective tissue, patients are actually amazed at how much tightening they get. And so we're really able to address patients who are larger, who are older, and may be worried that if they have liposuction that they may get loose skin. We don't really worry about that anymore.
Yeah, because then they'd have to follow up with that trimming of that excess skin.
Right. So, a tummy tuck or like an arm lift or a thigh lift after lipo, it's really, really going out of favor because of the improvement in technology.
Great, doctor. Thanks so much for explaining this to us.
Of course.
Amazing pictures, too.
Yeah, and then, as I said, just get tickled this new year.
Okay, yeah, get you laughing, right?
That's right.
All right, for more information, go to san diego6.com and just click on Hot Topics.